So, for some reason, a mother didn't get to breastfeed her baby for a few days. And then she told me that the breast milk had gone sour. That's outrageous. Anyways, welcome to Raising Healthy Kids with Dr. Bumz. I am Dr. Bumi Fakeye Udogu. On today's episode, I'll be sharing a few guides to breastfeeding your baby. Do you know that less than half of infants between 0 and 6 months do not get to be exclusively breastfed? Exclusive breastfeeding means giving your baby breast milk only, either by your baby sucking directly on your breast or by you expressing your breast milk and feeding your baby with no other nutrient providing substance or even water. Breastfeeding is the most natural way of giving energy requirements and nutrient requirements to your baby from birth all the way to at least 2 years of age. There are quite a number of advantages with breastfeeding your baby. The advantages to your baby helps your baby to grow and to be strong and for great development, especially of the brain cells. Another point is that your baby's immunity is improved and strong and sustained with breastfeeding, such that your baby does not get the common childhood illnesses like pneumonia or maybe even diarrheal diseases. Then it helps your baby to stay alive, because when you are breastfeeding your baby is in contact with the warmth of your body, and then that helps your heartbeat, helps your baby's heartbeat to beat, and there your baby stays alive. Another advantage to your baby is that breastfeeding helps to keep them happy, gaining weight excellently, and you not having any issues with sudden death or sudden illnesses. There are some advantages to you who breastfeeds your baby as well. Would you rather have the shapy, curvy figure and have a malnourished child, or you have your shapy, curvy figure and have a healthy child? Yes, you heard me right. Do you know that breastfeeding helps you to keep yourself in good health and in great shape? And then do you know that it helps to avert some illnesses in you, the mother, especially some cancers? And then do you know that breastfeeding helps you to be economical? Yes, it gives you economic empowerment because you spend more when you buy other things to nourish your baby with. But when you breastfeed your baby, you actually spend less. It is safer, it is cheaper, and yet healthier for your baby. And that, for me, is why I recommend for you to exclusively breastfeed your baby from birth all the way to 2 years. You're welcome to the question and answer segment. Let's dive in. Oh yes, it's normal for breastfeeding to be painful at the beginning. Remember, it's an act and you need to master the act. So at the beginning, it may be painful, but do not worry. Keep putting your baby to breast, and within a few days, the pain is going to resolve and you'll be great at putting your baby to breast and breastfeeding. Yes, you can breastfeed your baby even if you have a cold. But if you are so ill and so weak that you may not be able to sustain the breastfeeding, then you may pause or talk to your doctor. But you can actually breastfeed your baby even if you have a cold. You can just cover your nose so that while you're sneezing or while you're coughing, you don't do that directly on your baby. No, 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 no. Now, the reason is it affects a lot and disrupts a lot of functions in your baby's immune system especially. And you do not know the quantity that you would have taken to cause the disruption. So we generally would advise mothers to stay off alcohol in the course of breastfeeding. Well, you own your body, but remember, you brought another individual to this world whom you need to care for. If there are reasons why you do not want to breastfeed your baby, talk to your baby's pediatrician, and the pediatrician will give the right advice. You can also send a DM to us or an email, and we would advise you on your peculiar and unique situation. So it probably means that attachment was not properly done, and that's why the nipples cracked. But not to worry, you need to rest the nipples. You need to remember to position your baby appropriately and attach your baby to the areola, that area around your nipple, which will prevent the risk of having cracked nipples. But if you do have cracked nipples, you rest the nipple until it's much better and then resume breastfeeding on it. So you can breastfeed your baby. Remember, one of the qualities of the exclusive breastfeeding is to breastfeed on demand. However, you can get a flannel to cover while you are breastfeeding your baby. And with that, we've come to the end of the question and answer segment. Remember, drop your questions in the comment section or send an email or DM, and we'll be right with you with answers that will work for you. No, not at all. False. You actually can get pregnant while breastfeeding. Oh, no. Please continue breastfeeding your baby even though teething has started. Nah. No. Your doctors would always advise when you're a lactating mother who requires to take medications.
And we've come to the end of today's episode of Raising Healthy Kids with Dr. Bumz. Remember to turn on your notification button and follow us in the next episode. Remember to like, follow, share, and send your questions to the comment section, the direct message to us, or an email. And let us know which topic you would like for us to address in the subsequent episodes. I remain your one and only Dr. Bumz. See you in the next episode of Raising Healthy Kids with Dr. Bumz. Bye!